I do a lot of preventative care, management of common acute conditions and common chronic conditions. So a lot of times I'm seeing people for their wellness visits to discuss preventative care, to help manage and prevent the complications of things like diabetes, high blood pressure, high cholesterol, lung disease, heart disease, kidney disease. And then when people get sick, this is usually one of the first places that people come to see me. I think the patient-doctor relationship is the most important thing in medicine, and so I like to be able to spend time with my patients and get to know them on a personal level. And that is one of the things that I like about my area of specialty, is that I'm seeing people over a long period of time, many times, so it's a relationship that forms over that long term. I like to use pretty straightforward and upfront and simple communication to be able to find ways to help process the information so that we're on the same page. So I'm originally from the Pacific Northwest and did a grueling 4 years of medical school at Dartmouth Medical College in Hanover, New Hampshire. Then after that, I went back a little bit more west and did a pretty intense internal medicine residency in Denver, Colorado, where that was a 3-year training, and that was with a specific focus on primary care. But that included a lot of time in the hospital, a lot of time in other specialty clinics, and a pretty wide-ranging experience, and like I mentioned, a pretty intense one that provided a lot of experience and training hours for me to be able to start to learn and hone my craft of practicing medicine. What I've been doing for the last 9+ years is working 100% in an outpatient setting, so that I can focus all of my attention in seeing patients in the clinic. And while I have a lot of experience, a lot of hours in the hospital, that is not part of my practice right now. I think the most important thing in healthcare is the patient and physician relationship, and everything else stems out from there. There's a lot of frustration, I think, with the way that medicine is practiced and organized in the United States at this point in time, and I feel that frustration. I know our patients feel that frustration, and I think a lot of that stems from power being taken away from that patient-physician relationship. And so my goal is to help strengthen that and maintain that as much as possible. I like to focus on what I know and what the patient is looking for, and that is the basis of our treatment. And it's not a cookie-cutter approach, it's not a one-size-fits-all, it's a very tailored approach that is collaborative between myself and my patients, and that relationship is really the most important thing, hands down. Hi, I'm Aaron Galbraith. I'm an internal medicine physician, and I'm practicing at the Freighter Pleasant Prairie Clinic.